Hey everyone, I hope we can actually bring Bristle Health in now. This is the second time I'm joining. Sorry. Good morning everyone, welcome. And my name is Dr. Mani Kukreja. I'm the founder of integrative health and wellness practice called Live Age Well. And I'm excited to be here today with my guest, Danny Granick. He's the co-founder and CEO of Bristle Health, which is an oral microbiome testing company. Let's see if Danny can be here. Let's see. I am actually going to send a request to Danny to join. Let's bring him in. Okay. This is all right. Bristle. All right, let's see. Oh, wow, very nice. Good morning, Danny. Good morning, everyone. So we'll start now. I'm sorry, we had some trouble previously. All right. Good morning, everyone. I am Dr. Mani Kukreja, and I am the founder of integrative health and wellness practice called Live Age Well. And I'm very excited to be talking about oral health and oral microbiome today. And we have our guest, Danny Granick. He is the founder and CEO of Bristle Health. And Danny, super excited to have you here. Welcome. And I can't wait to deep dive into our conversation about the innovative company like yours, Bristle Health. And I want to hear everything about it. You know, it's pioneering, it's innovation in oral health, and I'm very excited to hear about it. But before that, I will just give a little introduction to my audience about you and Bristle Health. So Danny is the CEO and co-founder of Bristle Health, and it's an oral microbiome testing company that comprehensively analyzes your oral microbiome through single saliva test by using the genomic techniques to provide deep insight of the oral cavity microbiome. So this is about Bristle Health, and you know, for audience, just to you know, have a little quick start, you know, about the microbiome. You know, the microbiome are the foundational of our overall health. Microbiome are all these clitters living in our body, on our skin. You know, they are basically right from the oral cavity all the way from entry to the exit colon. These clitters are actually living inside us. You know, so. And the most exciting thing is that they are more than 40 trillions in number. So their number is even more than our own body cells, you know. And not only in numbers, their genes are like around 3 million, and our genetic component is around 23,000. Right. So genetically, as well as in number, they overnumber us. Right. So they are basically the foundation of our own body. Right. They are controlling us. Right. But they at the same time, it's the good and the bad bacteria both. But those good bacteria are so good for us. It's so critical to our overall health. They are good for our overall health. They are good for our immunity. They are good for our digestive health, respiratory health, skin health. They give us those neurotransmitters which are responsible for happiness, motivation, awareness. And they, I mean, if we don't have these biases, and if we are in symbiotic relation with our bacteria, the good bacteria, our brain health is really good and optimal, you know. But if we have any bad bacteria or opportunistic bacteria or numbering or there's a dysbiosis, then we suffer from mental fog, you know, learning problems, mental fog, and the memory problems. So all that issues. So they are very good for our emotional and physical well-being, you know. So they are so important. And you know, until now, I know oral health and the oral microbiome is such a new field. Not really new, however. Since 2005, we have been digging deep into this particular science. But before that, we were always concerned about the gut microbiome, right? I mean, thinking that gut microbiome is all, but you know, oral microbiome is also as important as gut microbiome. I think the gut microbiome is the gateway to the, oral microbiome is the gateway to the gut microbiome. So anything starting from the oral cavity all the way to the gut lining is so important. So I think this field was really it really needed to be explored more, because there are some problems I know in the oral cavity problems. A lot of dental issues are mostly because of the dysbiosis in the oral microbiome, and all these problems like gingivitis, like root canal infections or bad breath, metallic taste in the mouth, halitosis, and all these periodontal problems, they can be avoided, they can be prevented. The good news is that they can be prevented if we know about our pictures of the oral microbiome, and if we could take any preventative measures to avoid that dysbiosis. So that's a good news. And I think that's where the role of the company like yours, Danny, Bristle Health, is so important, because you guys are pioneering in this innovation that you are actually basically taking patients' saliva and their sample and testing and providing the picture of oral microbiome of that particular patient or that particular person, which is so important for prevention purposes. And not only for prevention purposes, I think it is so important for community education, right? For the awareness in the community that how important is overall oral health is. And since oral health is so connected to systemic health, so it's very important to basically take care of the prevention as well as education in this field. And not only that, we will hear more from you, that how do you test, and how is the whole process working, and what are the further benefits. And I think it's such an innovative technique to basically it's a gateway to so much more new research and findings in this particular field. So I'm all excited to hear all that from you, Danny. All right, let's begin. So Danny, tell us about your company, Bristle Health, and how did this originated? How did this idea start?
Yeah, so the background behind Bristle, we at our core really help people, I think, measure, understand, and improve their oral health, and we do that by measuring the oral microbiome. So the oral microbiome, like you said, is kind of the makeup of fungi, bacteria, and viruses that live in our oral cavity, and they play a role in our oral health, our overall health, and they play a variety of roles in certain oral health conditions and as systemic disease, as we're finding out with more research. The background of the company, our whole team, or a large part of our team, actually comes from the sequencing and genomics industry. We don't come from oral health ourselves, so we had kind of been exposed to a lot of innovative applications for this technology in areas like oncology, non-invasive prenatal testing, of course, the gut microbiome, which has seen an explosion in data and research around it. And for us, it always seemed like oral health was this massive gap. We didn't see any companies really innovating in the space. There was not a lot of research and not a lot of literature around the oral microbiome. And the more that we dug into it, the more we realized how close the connection was between the microbes in our mouths and our risk for conditions like cavities, gum disease, halitosis. It helps that one of our co-founders, I think, like a lot of people, is a patient with oral hygiene and inevitably has cavities every time he sees the dentist. So a big part of the company was kind of understanding why. I think that's been overlooked in dental care. And a big part of it is because we don't have accessible tools to give that information to patients and providers to act on.
Right. Yeah, that's a good start. And so when people do this testing, what is exactly the technique of testing? Is it the sample from the saliva? Is it just like a one-time sample, or do you recommend doing it every 3 to 6 months, or how does it work?
Yeah, so the way that the test works is we take a very small saliva sample, but it gives us a really good representation of what's going on generally in the oral cavity, and we send it to our lab. I won't get too far into the technical details, but the idea is we identify all of the microbes in the sample, and we're also able to quantify how much of each microbe there is. So you can imagine that if you have a lot of disease-causing microbes in your sample and you have high abundances of all of them, your risk for certain conditions is higher than somebody who only has beneficial bacteria, has very small amounts of pathogenic bacteria in their saliva. Based on those results, we then paired people with product, diet, hygiene recommendations, really focused on prevention and rebalancing the oral microbiome. The product itself, we offer kind of like a one-time test if you just want a snapshot of your oral health. But I think, again, as many patients and I'm sure providers are aware, oral health changes over time, and the oral microbiome is a constantly evolving and shifting environment. So we have a subscription offer as well for people that really want to kind of monitor their oral health and then tweak their hygiene and the products that they use to keep it really well balanced and mitigate their risk for disease.
That's amazing. And Danny, tell us this, that, once a patient gets the whole analysis of the picture of the oral microbiome, they get to know their good microbiome, the good bacteria and the bad bacteria. For example, if a patient or if you find some alarming sign or maybe a red flag that there's a particular bacteria which is more like pathogen, right, causing infection. What do you really do? Do you basically make recommendation to the people about just the change in the lifestyle and the diet? Do you also refer them to a particular dentist or particular clinical care who are specialized to take care of that kind of specific problem?
Yeah, I mean, I think in some cases because of the technology that we use, we can detect these bacteria at the very smallest abundances before they've had a chance to cause damage. So our ideal case is you don't have symptoms of disease yet, or maybe you have the very earliest signs and you're kind of concerned about something. And we can identify the kinds of microbes that are contributing to that condition and then really focus on prevention-based interventions to mitigate your risk. But there are a wide variety of applications for the technology itself. So for somebody that has more progressive disease and maybe already sees a dentist, there's often kind of a gap in knowledge around specifically what kinds of bacteria are causing that condition. And by taking the test, we can help providers and users kind of work together on treatment plans and really identify the best-in-class interventions to treat whatever disease that patient is facing. So it really depends on kind of where you are in the health to disease spectrum, but there are applications for our test and everything.
That is awesome. And, because we know to date that, the nutrition, the diet, the lifestyle practices, these are some of the major factors that can disturb our microbiome, So based on all those findings from the analysis that you're going to provide us, you're also going to provide to the patient the recommendation, that if the patient needs to either change the toothpaste, or, not using too much of, these mouthwashes, which have too much bactericidal triclosan, or maybe they have alcohol, because of that bactericidal effect. They not only, these mouthwashes, the repeated use of these mouthwash, they not only kill the bad bacteria, but they also kill the good bacteria, So those kind of recommendation, and we appreciate that so much, because that kind of education in the community is so much needed, I mean, that is something even besides, beyond from dental care that they get, because, when they go to a dental practice, they get diagnosed of their problems. They know the symptoms, they get diagnosed, and they get the best treatment plan. And but the company like yours is, I think it's such a great idea to basically find the problem or any indication of the risk factors way ahead in the plan, so that you can take control of your own oral health and dental problems, and then systemic health, because oral health is just not the oral health, right? I think if there is any disbiases, or if there is a difference if there is a messing up or imbalance in the variation of these bacteria in the oral microbiome, there's a lot of research and data that connect us that, these particular microbiomes or these particular pathogens can cause the risk factor for cardiovascular disease, for Alzheimer's, or maybe for rheumatoid arthritis. There is so much data, there is so much research backing up that science. And, because just like I said, it is just one continuous line from oral cavity to the gut cavity, and they're all connected with each other. So there is no way of separation of the microbiome from the oral cavity to the gut cavity, to the gut, so all the oral cavity disease, they can actually cause increase in the risk factors of many systemic problems. And do you want to discuss any research that you have recently found, that how these particular bacteria or any particular indicator, any particular alarming bacteria can cause increase in the risk of diabetes or increase in the risk of Alzheimer's or cardiovascular disease? Do you want to talk about that, Danny?
Yeah, I mean, I think that that's been one of the most exciting parts of the company. For decades, I think that we've seen clinicians and various stakeholders in dental care talk about the associations between poor oral health and poor overall health outcomes. We know that there are associations between periodontal disease and diabetes, or cognitive decline in Alzheimer's or cardiovascular disease. But I think there's always been a really big question around why. Why are they connected? How are they connected? And, we think that the oral microbiome is really going to answer a lot of those questions. And we've already started to see that. So there's been some really great research getting done at academic institutions. There have been a couple of landmark papers over the last couple of years investigating the role of P. gingivalis in Alzheimer's. And we know that P. gingivalis produces a toxic protein called gingipains, and those gingipains can cross the blood problems that are related to the onset of Alzheimer's. We've also been doing a lot of kind of internal research ourselves and investigating the data. I think last week we launched a new feature that really focuses on the bacteria in your mouth that are connected to gut dysbiosis. So to your point, the mouth and the gut are physically and chemically connected in our bodies, and a lot of the pathogenic bacteria in our mouths can migrate to our gut and cause a whole host of problems. So some of those bacteria confer damage to our gut themselves. Other kinds of bacteria can kind of launch inflammatory immune responses that cause gut inflammation that we associate with conditions like IBS, IBD, and Crohn's disease. So the focus of that feature is really taking what's in your oral microbiome and educating you as to the role that it might be playing in other parts of your body. And we'll continue to kind of launch new insights and features around those kinds of things.
Yeah, fantastic. I mean, it's amazing to see. I was reading that research. I mean, I am a factual person, but I'm pretty much data driven. I have to. I do believe in all the facts that are told to me through the books, but I love to support the information with the research. And I was actually reading that research that patients who have the gingivitis or maybe many other periodontal disease, they are 5 times more prone. There's the risk factor of having the HbA1c increased is 5 times more than their control population. And it's an amazing research. And also, 19 times more increase in the cardiovascular disease risk, right? And I think there's so much connection to it because, most of the nitric oxide, 25% of the nitric oxide that is produced in our body is from the oral cavity, from the oral microbiome. And I know if that nitric oxide is actually compromised, so there's a lot to do with the blood pressure, cardiovascular disease and the blood pressure, because nitric oxide is a vasodilator. So it can cause a lot of cardiovascular problems and heart pressure, the blood pressure problems. So, and in those cases, there are so many risk factors with these patients who are actually maybe, and I'll now go to some of the lifestyle practices, people who are more at risk of having these kind of problems, and finding the picture of the microbiome in those particular high risk factor patients, is so important to control further outcomes and to control further quality of life for these patients. For example, people who are mouth breather, they sleep with their mouth open. You're supposed to be breathing through your nose, right? But people who are mouth breather, because they sleep with their mouth open and their oral cavity is very dry, their oral microbiome gets dysbiosis. They're at high risk of getting the dysbiosis in their oral microbiome. Not only that, their diversity of the microbiome get disturbed. These particular these patients who are mouth breather, and plus also because during night, our saliva production anyway goes down. So saliva production is down, so the pH tends to get more acidic. And in acidic pH, all these microbiomes, the good ones that we need, they don't survive. And that's how we suffer from dysbiosis. And then because of dysbiosis of all these microbiomes, all these problems like cavities, bad breath, metallic taste, gingivitis, root canal infections, and many other periodontal disease, the risk factors for those disease gets higher. And when risk factors for these particular periodontal disease gets higher, are systemic diseases like cardiovascular disease, Alzheimer's, diabetes mellitus, and also the rheumatoid arthritis kind of autoimmune condition, they're at high risk, So, this is amazing. And so it's a very important, it's a very, very important innovation. And what do you think, Danny? Tell us all the people who actually, you send the kit to us and we do the testing, and then that results come back to us. Are you guys also collecting that data on any platform? And how are we gonna, and if you are collecting that data, how are we gonna use that data for doing further clinical research in order to get more and more information in this field?
Yeah, I think that's another really exciting component of the company. So the data that we're collecting is really abundant, right? And we want to leverage it to uncover new associations between the oral microbiome and certain components of our health, whether that's in our mouths or other parts of our body. So the more people that take the test, the more we can investigate this data. Of course, everybody's data is completely private. It's all de-identified, but having the data there and being able to really go through and analyze it and uncover new associations means that we can make new discoveries around the connection between the oral microbiome and oral and overall health. And as we make those discoveries, we can launch them as new insights in our report. So, our users will continually see kind of new scores and new insights getting added over time, even if you just take the test once. And what we imagine is that the more insights we provide in the report, the more recommendations we include, the more education we do, the better the relationship is going to be between the consumer and their provider, because they'll have so much more to discuss and so much more action that they can take. We really want to shift, I think, this model of kind of reactive treatment and procedure, and make it this model of continuous kind of engagement and consultation, and really partner the provider and their patient to work on oral health together.
Right. No, that's amazing. And I think this is a very valuable platform that is not only providing the prevention background, but also providing the community education. So prevention, community education, plus also personal recommendation, right, about the diet and any products that actually can improve our microbiota. And then on top of it, you guys also have this platform for collection of the data, which is going to be so useful in the field of functional dentistry, in the field of functional medicine, and also in the field of prevention of disease, to further improve the patient's outcome and quality of life. So this is, this is a plethora of benefits that we can get from this particular innovation, and I'm very excited. And so this is really great. So Danny, tell us this, that are there any particular products that you would recommend, versus what we use now as a part of standard of care? We use a lot of toothpaste, which has fluoride, and we use all these mouthwashes. What kind of recommendations would you actually tell us for these products? What do you prefer? What kind of products you prefer, and what are the ingredients in those products?
Yeah, I think, broadly, what we want to focus on is matching the right products and the right changes to the right person based on exactly where they are in the oral health spectrum. I think that a lot of consumers tend to fall into, these extremes, right? Like they either do nothing and kind of they just keep brushing and flossing, but they don't really change anything, and they wonder why they always get disease. Or we fall on the other side of the spectrum and people use really harsh antibiotics or really harsh mouthwashes, and as you see, out the good and the bad bacteria. So, we really want to kind of fall in the middle and make sure that we're making the right product recommendations and the right behavioral change recommendations that best suit that patient for wherever they are in their oral health journey. I think like really specifically, I've been really interested in nanohydroxyapatite. I think it's like a really cool kind of new alternative to fluoride-based toothpaste, and I'm excited to see more research come out around that. I think that I'm excited around the potential with probiotics, certain oral health probiotics, and I'm excited to see a lot more data come around those as well.
Yeah. Yeah, no, that is true. Hydroxyapatite is a great stuff for the calcification for our teeth. It's good. It's very good, and I do see a lot of research coming on this particular stuff. Then using the fluoride toothpaste. What do you think about xylitol? What is your take on xylitol?
I think xylitol is, everything that I've seen on xylitol shows that it's a really promising intervention, and I don't think that it's been used enough. It's this widely available kind of sugar alternative. It really starves a lot of the pathogenic bacteria living in the oral cavity. It's been shown to have a lot of health, beneficial health effects, particularly for oral health. And a lot of our consumers aren't really aware that it exists, and that, a lot of products have it in there. It's a very simple kind of change to implement. I've been excited about xylitol.
Yeah, xylitol. So do you have any particular brands that you like to recommend? Any particular brands yet, or that particularly have all these ingredients in that product?
Yeah, we tend to stay pretty neutral on the companies that we recommend. Obviously, we want to make sure that the companies are producing good products, but we want to come from kind of a science-first perspective. Yeah. So we focus on the ingredients that are going to be most beneficial. And then, of course, like in the recommendations, we do mention companies that have those products, but we don't have any kind of financial relationships or anything with those companies. We just want to provide the information to our users.
That's great. And maybe with more research and more data, there would be invention of more products based on the clinical research that you provide and information that you provide, that, something more products can be actually in the market that have hydroxyapatite and xylitol and some prebiotic, just that, no fluoride, So that's still to be coming, and I'm excited to see more and more on that, So, Danny, as a regular practice, like when we as a patient or just as a regular dental checkup, we go to the dentist and they do our diagnosis, x-rays and testing and diagnostic. And if we have any symptoms, they do treat us, and they ask us about smoking, alcohol, and all those risk factors, or maybe how many times you brush, how many times you floss. So besides all that, do you see your company, the future of your company, being as a screening practice, as a regular screening practice to get the oral microbiome picture later in future at the dentist? I mean, when we go as a part of our dental care, would we be able to see that as a trend or as a normal practice along with all the other diagnoses that dentists perform on us?
I think, yeah, the oral microbiome should be a part of the standard of care, right? Like it should be one of those things that you get every time you go to a dentist, or you should come in with your results before you go see the dentist so that you can work on a care plan together. And I think that the oral microbiome, it has some really exciting applications in being used as a screening tool, but there are so many applications downstream and just being able to do precision diagnostics and really identify kind of the root cause of a patient's condition. And there's a lot of work to be done as far as defining care pathways based on specifically which microbes are there. But I think that the microbiome today is still miles ahead of where we are now.
Yeah.
So, my dream would be that it kind of gets worked into the standard of care.
Yeah, no, that is true. That's powerful. So, and I think this company is pioneering in all that innovation, and it's going to bring a lot of information to us, in community. And I am very excited because I do believe, I do believe in functional medicine. I do believe in prevention of the disease rather than curing it later, rather than putting the bandage on the wound. It's better to actually take control of your own health and you try to prevent the disease right at its first place when it's actually starting to happen. And for that, you need to know what's going on in your body. And I think company like yours, this particular innovation is actually on a mission to do that. It's not only a prevention platform, but it's also providing us the lifestyle and the diet recommendation, the product recommendation, and it's also actually providing the education to the community by looking at the picture that you're providing us, that what is good and what is bad bacteria in our oral microbe, in our oral cavity, and how can it affect our overall systemic health. And so prevention and innovation, and then education to the community, and also personal recommendation. So considering all those four missions or goals that you have in line, I think this company is going to be doing great, and not only that, it's also going to be providing a platform for clinical data to many other resources in order to do more and more research to find out more information in the science, in the oral cavity science, and as well as in functional dentistry. So this is really, really great that you're doing for the community. I am very excited about that. And I, for my audience, I will tell them, do this testing so that we can collect, so company like Bristle Health can collect more and more data, and more data you have, right, more information we can explore for our future, for us and for our kids and for our future. More information we can collect in the oral science, oral health science. And you guys are doing great. Thank you very much. And for my audience, for everybody who, if you have any question, please comment here or text me or text Danny, text Bristle Health if you have any question, and go ahead and do this testing. And it's amazing, how you can actually see the picture of your own microbiome, and it's not a difficult test. Right, Danny? I mean, when do you get the results of this testing? Like if I sent you the sample today, it's like the saliva testing. What are you actually doing in that testing? You're just sending the saliva to your labs, right? And after that, how many days do we expect the results to come back?
Yeah, so the sample processing usually takes around 2 to 3 weeks. The sample processing takes about 2 weeks, so you should get your results within 2 to 3 weeks.
Yeah, that's great. And so this is all awesome stuff. And it was my pleasure to have you here, Danny, at my platform and discussing all the insight about this innovation. And I'm very excited to see the future of this company. And maybe in future we'll do more series like this and get into more details about oral health and oral microbiome. And thank you for joining us. I really did enjoy my conversation with you, Danny. Thank you.
Thanks for having me.
Okay, bye-bye.
Thanks.